So our today's topic is hemodynamic rearrangement. What do you mean by hemodynamics? First of all, the hemodynamics is the principle governing the flow of the blood within the circulatory system that ensure that the blood is efficiently delivered to various tissues and the organ of the body. Now, the normal circulatory function, it requires a continuous blood flow. The circulatory system, it functions to transport oxygen, nutrients, and waste products to and from the cells. So that involves a continuous flow of the blood through the heart, arteries, capillaries, and the veins. The normal circulatory function again, it requires continuous blood flow from the left ventricle to the farthest capillaries in the body and from the systemic capillaries back to the right ventricle. So from the right ventricle to farthest capillaries and back to the left atrium. So what are the essential requirements for the normal blood flow? First of all, they should have a normal anatomical features. In order to maintain the normal blood flow, the structural integrity of cardiovascular system is very important. First of all, the heart must be free of structural defects like the congenital malformation, valve dysfunction like the myocardial infection, like damage from conditions like myocardial infection. So it needs to pump efficiently to maintain the adequate cardiac output. The arteries, they should be free from blockage like those caused by atherosclerosis, and they should have intact and elastic valves that responds to changes in the blood pressure. Apart from that, capillaries must have intact wall to facilitate exchange of nutrients, gases, and waste products between the blood and tissues. The vein, they are capable of efficient returning blood to the heart. That includes they must have functional valve to prevent backflow and maintaining the adequate venous tone. Apart from that, they should have a normal physiological control. That means the sympathetic and parasympathetic nervous system that regulates the heart rate and diameter of the blood vessel. That includes the vasoconstriction and vasodilation. As during the stress, the sympathetic system, it increases the heart rate and constricts the blood vessels to redirect blood to the essential organs. Apart from that, hormones like adrenaline, noradrenaline, angiotensin 2, ADH, that plays a role in all these hormones. They play a important role in regulating blood pressure and blood volume. We know that adrenaline, it increases the heart rate and force of contraction, whereas angiotensin 2, it causes vasoconstriction and stimulate the aldosterone to increase the blood volume. Apart from that, local factors like nitric oxide that is released by the endothelial cells that causes vasodilation that increases the blood flow to the tissues. The third is there should be normal biochemical composition of the blood. So we know that blood, it contains red blood cells, WBC, and platelets. The blood, it must carry nutrients and gases to and from the tissues. The plasma proteins like albumin, it maintains the oncotic pressure, prevents fluid from leaking out of blood vessels into the tissue. Fibrinogen is important for the blood clotting. Apart from that, electrolyte and pH balance like sodium, potassium, calcium, bicarbonate, they are essential for cellular function and maintaining the acid base balance of the blood. So all these should be normal in order for normal essential requirement for normal blood flow. Now we categorize the hemodynamic disturbances that are the disturbances in the volume of the circulating blood. They are the hyperemia, hemorrhage, shock, and disturbances of obstructive nature. They are thrombosis, embolism, ischemia, and infarction. The first we are going to discuss is disturbances that are in volume of the circulating blood. The first is hyperemia and congestion. So what do you mean by hyperemia? So hyperemia and congestion means increased blood flow and accumulation of blood in particular tissue. The hemorrhage is loss of blood from the circulation due to the vessel rupture, and shock is inadequate tissue perfusion and oxygen delivery to the cardiovascular system. Now, hyperemia is increased blood volume within dilated arteries and arterioles. So, what are the features of arterial hyperemia? Hyperemia can be active hyperemia that results from increased blood flow due to the arteriolar dilation in response to local factors like exercise, inflammation, or emotions. So, clinically, you will see redness and increased temperature in the affected area. Now, the question is, what does the active hyperemia means? So, active hyperemia, it results from increased blood flow due to arteriolar dilation that results from local factors like exercise or inflammation. So answer is increased blood flow due to arteriolar dilation. Now these are example of active hyperemia like inflammation, blushing, menopausal flush, muscular exercises, high fever, goiter. So these all are example of active hyperemia. Now the passive hyperemia is known as venous congestion. So what is passive hyperemia known as? The answer would be venous congestion. It occurs when the veins and capillaries they are dilated due to inadequate venous flow. So you would see is bluish discoloration of the affected tissues. Now, the cause of the venous congestion could be obstruction of it could be the portal venous obstruction like cirrhosis of liver or external pressure from bandages, etc. The systemic venous congestion, it could be due to the example is left-sided heart failure. The left-sided heart failure, it is caused due to pulmonary congestion due to increased pressure and fluid buildup in the pulmonary veins. Whereas the right-sided heart failure, it occurs due to pressure and fluid accumulation in organs like liver, spleen, and leg vein. Which of following organ is not affected by systemic venous congestion due to the right-sided failure, right heart failure? It's the lungs. The right-sided heart failure, it occurs when the right ventricle of heart is unable to pump blood forward in the pulmonary circulation. That leads to increase in the pressure of the right heart. So this increased pressure causes blood to back up in the systemic venous congestion. So this systemic congestion involves the organ like liver, spleen, kidney, and the leg veins. So answer here would be lungs. So the left-sided heart failure, remember, it occurs when the left ventricle is unable to adequately pump blood into systemic circulation. That causes blood to back up into the pulmonary circulation. So this increased pressure leads to pulmonary venous congestion, primarily affecting the lungs. So the chronic venous congestion of lungs result in fluid accumulation within the lungs. So this condition is known as pulmonary edema. So you would see shortness of breath, difficult breathing, and respiratory failure. So remember, the lungs, they are primarily affected by left-sided heart failure and not by right-sided heart failure. Now let us discuss the chronic venous congestion of the lungs that is often caused by, remember, left-sided heart failure. And it occurs in condition like rheumatoid mitral stenosis. So that condition impairs the left ventricle ability to pump the blood effectively into the systemic circulation. That leads to pressure in the pulmonary veins. So that this condition narrows the mitral valve, obstructing the blood from the left atrium to the right ventricle. So that obstruction leads to increased pressure in the right atrium and in the pulmonary veins. So when you will examine, the lungs would be firm and heavy. There would be rusty brown. The lungs feels firm to palpitation. That means they have an increased density and stiffness due to the congestion. The color, on sectioning the lung, the cut surface that appears dark and rusty brown. So that discoloration is known as brown induration. So remember, this brown induration, it is caused by hemosiderin laden macrophages within the alveolar space. So you will see there is chronic leakage of red blood cells and subsequent breakdown of hemoglobin. that results in accumulation of hemosiderin-laden macrophages within the lung tissue. Apart from that, you will see is fluid that accumulates in the interstitial spaces of lungs that will contribute to the firmness and heaviness. The fluid also accumulates within the alveolar spaces that impair the gas exchange, and that causes pulmonary congestion like dyspnea and orthopnea. On histological features, you will see the walls between the air sac, they are widened because of fluid buildup and presence of dilated congested capillaries. There is thickening of the lung tissue due to small increase in fibrous connective tissue. Apart from that, hemorrhage that could be seen, the bleeding spots can be seen within the air sacs, that are the alveoli that are caused by ruptured capillary that leaking the blood. Apart from that, you should notice hemosiderin pigment that is relieved from the breakdown of red blood cells. It is taken up by certain cells that are macrophages in the air sac. So these cells, they are known as heart failure cells. Now you get a question, what are the heart failure cells that are seen in the chronic venous congestion of the lungs? So the answer is macrophages filled with the hemosiderin. The heart failure cells, they are the macrophages filled with hemosiderin resulting from the breakdown of the red blood cells in the lungs with the chronic venous congestion. The next comes the chronic venous congestion of the liver. It occurs due to right heart failure. Now the gross appearance, the liver is tender and enlarged, the liver becomes swollen and painful to touch due to increased blood flow. The outer covering of the liver, that is the capsule, it feels stretched and tense due to the enlarged liver pushing against it. So on cutting the liver, there is distinctive pattern that you would see is with red congested center of lobules that are surrounded by yellow peripheral zones. So that appearance is known as nutmeg liver. So you get a question, the chronic venous congestion of liver it shows what type of appearance? The answer is nutmeg appearance. Now the histological feature, you will see the most pronounced in the central area of lobule, that you would see ventrilobular congestion due to lack of the oxygen from the reduced blood flow. Apart from that, you will see the central veins, they are distended. The veins and tiny blood vessels in the central lobular area, they are swollen and filled with blood due to backup from the congested vein. Apart from that, you would see ventrilobular hepatocytes. The liver cells hepatocytes in the central lobular region, they show sign of degeneration which can progress to necrosis. Apart from that, fibrosis that may be seen. The next is the chronic venous congestion of the spleen. It is caused due to right heart failure. Early stages, it has the gross appearance. In the early stages, the spleen shows slight to moderate enlargement, weighing up to 250 gram compared to normal weight, that is 150 gram. Over time, the spleen progress enlarged Over the time, the spleen it enlarges and reaches the weight up to 500 to 100 grams. The spleen it becomes congested and it is bluish in color. And on cutting, it will show gray tan coloration. Now, histological feature that you will see is the red pulp. This area of spleen it is enlarged due to the congestion and dilation of sinusoids, that are the small blood vessels that may show area. In some severe cases, the sinusoids may undergo capillarization. They may convert into capillaries. You may say within the red pulp there is increase in the splenic macrophages that reflect the spleen role in filtering and processing the blood components. There may be fibrosis of the capsule and trabeculae that indicates the chronic changes. Apart from that, you will see gamma antibodies. So these are the siderofibrotic nodules formed from the organized hemorrhage. So they contain deposit of hemosiderin pigment, that is again from the breakdown of the red blood cells. And sometimes they show calcium deposit. So in which organ are the gamma antibodies typically found? The answer would be spleen. What pigment is typically found in gamma antibodies? It's the hemosiderin pigment. So they contain deposit of hemosiderin pigment from the breakdown of red blood cells. And sometimes they contain calcium deposit. So which of following best describe the gamma antibodies? They are composed of hemosiderin and fibrotic tissue. That would be the best answer here.